We're at the Mackinac Policy Conference today on behalf of the Michigan Health and Hospital Association and, of course, the Common Bridge podcast and Substack page. And we have with us today Bill Manns. He is the president and chief executive officer of the Bronson Healthcare Group in Kalamazoo, Michigan. He's also chair of the Michigan Health and Hospital Association Board of Trustees. Bill, it's great to see you.
It's great to see you as well.
How have you been?
I've been good. Life's good. Very busy, but good.
That's good. Well, you're in a unique position. You have a substantial independent health system in the state of Michigan.
Yeah.
And that has to bring some differences with some of your peers. So do you want to talk about that a little bit?
I absolutely love it. The fact that Bronson's independent. We're a 4-hospital system serving 9 counties in southwest Michigan. We are by far the largest employer, so 9,444 employees last time I checked. And so the notion of being independent allows us to do things that I couldn't do when I was part of larger health systems. The notion of delivering local care. Our board is totally local, and so they get their care at facilities that are part of Bronson. And so I get direct feedback from those board members and from their neighbors, and so absolutely love it.
That's a very unique perspective. As you're in your role as the chair of the MHA, what's top of mind for Michigan hospitals?
Oh man, where do we start? So this notion of affordability and what's it mean, right? And how do we ensure that hospitals aren't to blame? I think the volatility associated with some of the legislative acts that really keep us moving. It's one thing when you understand where the legislature's headed. You can plan for it, right? You can adjust to it. But when it's up and down and it's really volatile, it makes it a lot more difficult to do effective planning.
Are there anything that any bills that are moving through the legislature that are causing you concern or maybe giving you hope?
Both, actually. I've got healthy doses of concern and healthy doses of hope. At the end of the day, I'd like to believe that we all want the same thing for Michiganders, and that's top quality healthcare at an affordable price that's easy to access. And so as long as we all want that, I think that's the common ground, right?
Indeed.
So, yeah.
And, when I think about this affordability,
Yeah.
it's, it could be, well, everybody's getting paid too much. All right, so we're all going to reduce our price or our compensation. And then the answer always is, well, you go first. All right. And what's the parts of the system that could be done, same efficiently, but spending less money? Every enterprise has to look and say, where can we take out costs?
Sure.
And if you step back now, by the way, look at it as an entire ecosystem. Where could costs come out?
You're absolutely reading my mind. I was going to say, it's not just the hospitals, it's not just the insurers, it's not just big pharma, it's the collective ecosystem, as you put it. There's a lot of administrative work that's totally unnecessary. I get fraud, waste, and abuse, but the notion of prior authorizations is a good example of, well, wait a minute, if the physician says that you need XYZ, why do we have to jump through several hoops for something that's ultimately approved? And so a lot of waste in that process. The notion of prices, you brought up that. Well, and I've got to remind folks frequently, hospitals don't set prices. We're not like gas stations that as, inflationary measures happen, we increase our price. Our prices are more often than not already set through insurance contracts we negotiated years prior from the federal government, who's often the majority payer. So we're actually price takers. The Michigan hospitals in particular have been incredibly efficient. Many of us go through lean work, Kaizens to improve efficiency, et cetera. But I think the untapped opportunity really is in that administrative component associated with, let's prove that patient needs that service. It's totally unnecessary.
Well, I'd be in strong agreement with that. And also, it's the only industry, hospitals, where if you get more efficient and better at something, that your revenue goes down.
Exactly.
Which, the economic benefit accrues to a third party. I understand that in Kalamazoo County, there's some work going on around trying to reduce black infant mortality. Now, this is an issue I'd never heard about. Tell us about that and what's going on.
Well, thanks for bringing it to light. So it's an issue that's near and dear to my heart. Before I took the job in Kalamazoo, I'd heard a lot about how high the black infant mortality rate was. And I can tell you the community had been working on it for a number of years. And so just bringing it to light, it was huge for the state, right? What we've been able to accomplish is the lowest Black infant mortality rate in the entire state, the lowest Black infant mortality rate since the county of Kalamazoo has been tracking it. And so it's a collective effort of the entire community, right? Bronson's one component of it, but I think the entire community wants everybody to start off kind of at equal ground, right? And so, how do you deliver care in an equitable way so that the women and the children who need services are receiving them? So, it's not just about what happens in the four walls of the hospital. I frequently talk about the importance of Bronson being a healthcare provider without walls. How do we reach out into the community? How do we reach to especially Black communities that historically have not trusted hospitals and build an element of trust with those communities? And if you can do it in one cohort of our community, I think you can do it in all cohorts of our community. And so, what do we learn from reducing the Black infant mortality rate? We've learned that we need to listen to moms and mothers, right? We actually need to be more compassionate in the delivery of our care. We need to really understand the difference between equality and equity. What is it that this given patient may need that patient over here doesn't need? And how do we deliver those services in a respectful way? So it's been fascinating for me to watch the community come together and to say, yeah, this is an important health issue, and collectively we're going to solve it. And not just say, that's a hospital's problem, or that's the health department's problem, or that's somebody else's problem. We're all in this together.
I'm sensing a theme that you're very talking about these issues. They may manifest in the hospital, but they're really global.
Exactly.
And they're part of that ecosystem. And, whether it's denials or infant mortality, in this case, Black infant mortality, it has to be addressed every place.
Exactly.
Right? Or otherwise they end up in the hospital as someone that didn't get prenatal care, for example. A lot of good has happened over the years, too. You've been at this for a long time. When you think about when you started your career, where we are today with medical care and what we can do, is there anything that jumps out?
Oh, man. It's, I was thinking about this as I was walking through. I started my career over 30 years ago, and it's not only the technological advances, but the notion of how do you really interface with the community in a different way? And I go back to outside the four walls of the hospital. The notion, and it sounds trite, but the notion of the electronic health record. Right now, I can pick up my phone and check on any test. That's such a huge advancement. I recall when I was in graduate school, I had a professor who said, healthcare is 10 to 15 years behind the rest of industry when it comes to IT. And to see how far we've come is absolutely huge. So that jumps out at me. The notion of preventive care. Historically, in the last 30 years, people wait until they were sick. And you're starting to see more efforts to reach out to the community so that people can live healthier lives now so they can thrive versus hospitals who wait until they get sick.
Yes.
And that's the only time we invite people into the four walls, right? So that notion of being a healthcare delivery system without walls.
Wonderful. Any final comments?
Well, I just really appreciate this opportunity. It's great seeing you again.
Good to see you.
Thank you for what you're doing.
And keep up what you're doing out there. We're talking with Bill Manns. He's the president and chief executive of Bronson Healthcare Group. And on behalf of the Michigan Health and Hospitals Association and the Common Bridge podcast and Substack, this is your host, Rich Helppie, signing off.
Rich, it's great seeing you, man.
Great interview.